Welcome to the Uzima Health and Wellness Podcast. What did the doctor say? In your career path, you've been studying and treating families with sickle cell disease, basically since you been involved in their care since college. So let's tell me about sickle cell and the disease. I think that we take for granted that these patients are okay, or that this disease is conquered. And so I was amazed at all the research still going on about sickle cell. So please tell us first, what is sickle cell disease? Mm-hmm. And let's then walk it through some of the challenges of the research.
Sure. So I have to say, having trained in these urban centers, and particularly in a city like Philadelphia, that had a large Black population, I had access to a lot of patients with sickle cell disease. I also had phenomenal mentorship in one of the pioneers of sickle cell disease research in medical school. And so really had great orientation to the disease from the outset. So when I then left Philadelphia and went back to Boston to train in pediatrics and then to train in pediatric hematology, this was always my focus.
Oh, okay.
So sickle cell disease is an inherited blood disorder that causes red blood cells to take on an abnormal shape in certain conditions in the body. We think of it as it is a blood disorder, but because blood goes everywhere, it affects all parts of your body. At the very early stages, one of the changes that sickle cell does is it affects the insides of your blood vessels. And so this creates a state of chronic inflammation. And one of the most common manifestations of sickle cell disease I alluded to earlier is this recurrent, severe, unpredictable, and difficult to control pain. So we've made amazing strides in sickle cell disease over the last 30 or 40 years, whereas in Africa now and even 30 or 40 years ago, sickle cell disease was a disease that was often fatal in childhood.
Yes. Okay. 30, 40 years ago. So in the 70s or like 50s, 1950s, you saw a high infant mortality rate.
Absolutely. So, we can talk about some of the evolution of sickle cell disease research, but we came to understand that a lot of these complications of early deaths from sickle cell disease were related to infections, and that we could prevent that with using vaccinations and using infectious prophylaxis or giving kids antibiotics to prevent infections before they happen.
Oh, okay.
But what probably one of the most important interventions was actually newborn screening.
Oh, okay.
This was recognized in the 70s, 80s that if we could test all children who were born for sickle cell disease, that we could then intervene earlier than if we waited until they had their first complication to make the diagnosis.
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What the doctor say?